So, ma'am, my first question is what's your story and how did you uh, get to where you are today? How did your journey start as a medical student?
Okay, so basically I am from Ranchi and I passed my 10th standard in 1994. Okay, it's in from Sacred Heart Convent School. It's a missionary school, ICSE board. I secured 91%. Then I joined DAV Shamli School, which is MS Dhoni's school, and I did my +2 from there. And then I through All India entrance, pre-medical entrance, I got a rank and I chose VSS Medical College, Burla, Sambalpur. It's in Odisha. Okay, so 1996 I was admitted. First attempt I got. Then I did my MBBS from there. Learned Odia because I'm basically not an Odia, so I learned Odia, and it was very difficult. The language problem was there, and somehow I managed. Then I passed out in 2002. In 2003, I was married. My husband is in pharmacology, professor. So I got married in 2003, and then I went to Mumbai with my husband. He was working there in Cipla. You know Cipla company, the medical company, the drugs company. So there he was working, and I did this thing tutorship for some time in D.Y. Patil Medical College, Navi Mumbai. I worked as a tutor first in the department of microbiology, then in the department of physiology, and then I was at the same time I was studying for PG, and I had a daughter at the same time. Then she was around 1 year old. Then I started again teaching and all. Then I got through PG again, and I took it in Odisha only because through state, because we are eligible if we have done a MBBS from a particular state, we can get PG in that state. So it is difficult to get in All India after having a child and all that. So I did not think of struggling too much. I took it in Odisha. I did it in SCB Medical College, Cuttack. Okay, and my inspiration to become a teacher is somewhere in D.Y. Patil. Actually, not exactly any teacher. My MBBS teachers were all great teachers. In anatomy also they were great teachers, like Dr. Chaudhary, okay, and my PG guide Dr. Chinara. They are all very good teachers. But basically, when I was doing a tutorship in D.Y. Patil, I realized that I can teach well because I got appreciation from students. And at the same time, I thought it is a less stressful work because we have to run the family also. And I started enjoying teaching. And I got positive response from students also that, ma'am, we are understanding what you're teaching, because initially I was afraid as to what I'll teach and what they'll understand. I did not have confidence in teaching. So that 9 months exposure as tutor gave me the confidence that I can teach. I'm not such a bad teacher. So then that's why when I actually
enjoy your class now.
in anatomy, actually, exactly I'll tell you, I took anatomy in the 4th attempt, though I was getting it every year. Because somehow that feeling of being a doctor, we as children and teenagers, we always think a doctor is one who puts a stethoscope in his neck and is seeing patients. So somewhere that was there with me also. I felt, what kind of doctor will I become if I'm not seeing patients? So initially I rejected 2 to 3 times. Always I got a rank in state PG, but somehow I was reluctant. I don't want to study physiology or anatomy or biochemistry or something like that. But then after 3 years of struggle and remembering those D.Y. Patil days, I thought it's okay if I become a teacher also. It's okay. I can run my family properly without having any night duties and all. So ultimately I decided I should take. And in Odisha also I got 120 rank. So I was getting in pathology, microbiology, community medicine I was getting. But in that case, I had to stay away from my family. So somewhere I give importance to my family. So I compromised on the subject. But I have no regrets. I really enjoy anatomy. It's not like I took it and I'm very upset about it. It's nothing like that. I'm quite happy in anatomy.
But what was your first preference?
My first preference was I would like to take pathology or skin. Because I wanted a no nonsense subject with no surgeries, because I don't like stress. I did not want surgeries. I did not want emergencies. So skin is a type of subject which is also a doctor, and exactly there's no stress because there's hardly any very serious condition. So I wanted skin, and pathology as a subject I liked. That is why I wanted. But anatomy, clearly speaking, I never imagined in my life that I am going to take anatomy. Because as medical students, we always stayed away from bodies. Means we used to see the structures, but we were never interested in dissecting. We never were interested to touch the body and dissect ourselves and take out the structure. That interest was not there. So initially I faced a lot of problem also in my PG. First year I felt as if I have never studied anatomy because we have never dissected. Now we have already seen. So it was feeble memory, and I did PG almost around after 7-8 years. So I had forgotten everything. So it was difficult. Thereafter I got PG. I did my PG, and then I'm here. Means I was there in Odisha also. I have worked in other medical colleges, and now I am here as associate professor.
Ma'am, describe your biggest challenge you have ever had to face in life.
My biggest challenge was that you cannot name one, but if you talk professionally, I did my PG from Cuttack and I was staying in Bhubaneswar. So the two cities are around 40 to 45 kilometers distance. So daily I had to travel by bus for 3 years. At 7:15 in the morning I used to start, and I had to reach my medical college by 9. And I had a small daughter, young daughter of 2 to 3 years age. So at that time my mother-in-law was of great help. So it's not always as mother-in-laws they show in the televisions. They are not always they are not always vamps. They are good people also. So like those 3 years I literally had to travel daily up and down Cuttack and Bhubaneswar, because I did not want to live in the hostel and keep my daughter away, my husband away, my family away. That's why I took up that challenge. So it was very difficult because first of all I was doing PG after a gap. So it was literally as if starting from zero, because anatomy is, you forget in 2 months. So I studied in 1996 and I did my PG in 2007. So it was 10 years gap. So everything was gone. So I had to start from scratch. So that part of my professional life was very difficult. And also in DY Patil, when I was doing a tutorship, my daughter was 1 year old. I had to cook. I had to go to the college at 10, come back at 5, prepare for tomorrow's class. At the same time, I was preparing for PG also. So I used to study till 3 in the morning, somehow to manage. So those were difficult times. Balancing your professional life with personal life, especially when you have a small kid and you have a family to look after. That was the most difficult time professionally.
Ma'am, what advice would you give to your younger self going to college?
To your younger self means students like you.
Yes, not to your own self.
To me?
Yes, when you were going to college, what advice would you give?
Okay. I feel we should. What mistakes I did, I can tell you. You should be more open to the teachers. You should approach them. Like sometimes I feel that like now we are so approachable. Maybe it was the teachers also. They were big professors, aged people, and very dominating and domineering personalities whom we were afraid to approach if we had doubts, if we had problems. And we feel now that in the private colleges at least, the students, the teachers are not very old. They are on a younger side. So they can understand the problems of students much better because they have also been through that phase. And if you approach them more, and if you have doubts, if you have any other problems, they will be understanding and they will help you out. Because I feel as a student, I studied well, but I was a little timid. I would never ask doubts. I would be at the back. So that is something which will suppress you. So you should develop your confidence by being more open to the teachers and approach them if you have problems and doubts. And second thing I would say that you should always take exams not for marks purpose, but for the purpose of acquiring knowledge and how to use it practically. How to use that knowledge practically instead of just mugging up and learning and writing answers.
But ma'am, as a student, my first subject is anatomy when I'm giving the exam.
Okay.
I'm so scared in the morning. I've started.
Everybody will have that.
I feel that, oh my god, I'll forget everything. I don't remember anything. Everything is zero inside my mind. So, ma'am, how to deal with that?
Basically, I think you have to be regular. That's only one thing which can be told, because as such the subject is so extensive. Only anatomy is big enough for 1 year, but actually you have to study physiology, biochemistry, DOH.
Yes.
So anatomy itself is a very big subject in itself. And the problem is that gradually the tenure is getting decreased, but the syllabus is the same, because we cannot stop teaching about one part of the body.
Yes.
We cannot reduce the syllabus in anatomy, because you have to teach the entire body. You cannot leave one part, okay, we will not teach this part. As BDS, of course, you are not reading everything. But MBBS students, we have to reach everything.
Yes.
And when we were students, it was around 1.5 years. Now it is 9 months, 10 months. So imagine how much we were taught and how much can we teach them.
Yes.
And not only can we teach them, how can those students grasp that amount of subject in 9 months with physiology, with biochemistry? They have to study those subjects also. So the only thing is you have to be regular. And you should have more of imagination and diagram practice, because diagrams will help you remember things better. In my MBBS exam, there was one student, I will not name him. He was a good artist. So what happened? We had anatomy 2 papers, anatomy 1, anatomy 2. Our anatomy was 400 marks. 100 marks one paper, 100 marks paper 2. We had 100 marks of practical and 100 marks of orals. So what happened? Like you were saying, itna hai, we learnt and we forget and all that. So because he was an artist, he was fond of drawing diagrams. So in the second paper, when the paper came, there was a blackout. He could not remember anything. What he did was, he only drew diagrams. He drew around some 70 diagrams. For every question, whatever diagram he could think, where that particular thing is there. Suppose for you it is, say, parotid gland or something. So any diagram which has parotid gland or parotid duct, something like that. So all the relevant diagrams, he went on drawing. And at the end of the exam, he said, I have not written anything. I have only drawn. So we all thought he is going to fail.
Okay.
He has not written. But he passed.
Wow.
Because diagrams will represent the subject much better than your writings. Because you'll say, this is related anteriorly to this, it is related medially to this, it is related posteriorly to this. But actually the diagram is showing everything. What are the anterior relations, posterior relations. So diagrams will not only show to the teacher that you have understood, also it will make you actually understand.
Yes.
So in anatomy, diagrams you have to learn. And observation is required, imagination is required, and you have to see the specimens. And as I said, you have to approach the teachers. If you are not getting anything, you should approach the teachers instead of discussing among yourselves, because what will happen, all the students will almost have the same doubts. So you cannot clear the doubts of each other. So it's better you can approach the teachers. Teachers are always available, and teachers are very approachable also, I feel. At least I am approachable. I don't know about the others. So you can always ask.
Ma'am, what advice would you give to the girls who want to break the barriers? We have this confidence. If we do something, we have this feeling, what will other people think?
That is there.
This generation, especially with the social media and all,
I feel this generation doesn't need any, they don't have any barriers, I'll tell you, seriously. Because when we were studying, we were like very conservative, and Odisha is quite conservative. So we hardly talk to the boys. And now, even in Odisha, what has happened is, they have started with student seminars. I feel the girls today are very smart. Hardly they have any barriers to break. And they are much better than boys in studies also, I feel. Because even though they have other problems, they are always very sincere in their studies. With all the problems, the girls try to concentrate more on their studies, and they give better results. And they are more thoughtful about their parents also. I feel that parents have struggled hard. They have given their hard-earned money to us to study. They want us to become doctors. That feeling of this thing is there. Feeling of love for the parents. Yes. That our parents have done so much for us. So we should make their head high, which is lacking in the boys. Not all. I am not generalizing it, but many boys will not have that feeling. but girls are more attached to their parents. That is what I feel. And barriers, as far as I feel now, the even parents are very much encouraging girls, and you can see your BDS attendance. Out of 100, I think 70 are girls only.
Yes, ma'am. Almost 80.
80 are girls. So imagine, boys are being sent less, girls are being sent more. Even in MBBS, there are more girls than boys. Because now everybody believes that let it be a boy or a girl, they should be independent. Because life is uncertain. Sometimes something may happen to anybody in the family, and then it is expected that if you are educated, at least you can run your family. That is why, and I think girls are very smart. They speak well on stage. They are doing very well. Rather, when we were students, we were very timid and never. I'll tell you, I have so much of stage fear. Now it is less. But I had so much of stage fear. That is why I thought I can never become a teacher. Because you have to speak in front of students. So if you have stage fear, how you will speak? And a class is something where you have read something and you have to speak. And you can't see a paper and speak. Even the PowerPoints, we don't write everything. We basically project diagrams. And we write certain things which we want the students to copy. Because that they should have as something they should have as notes. Otherwise, most of the things we try to say orally. So that requires a lot of confidence. And I would say if anybody lacks confidence, he should get exposed more to the public, more to public speaking, and let him make mistakes. It's okay. They are all your friends. And gradually in life you can overcome that barrier. And otherwise I think now the society is quite advanced. There are no barriers for girls. That is a long time back.
Ma'am, for what in your life do you feel most grateful?
Most grateful, okay. Here I would say I'm always grateful to God for all the good things He has given me. I have very great loving parents. I have one sister and one brother. My sister is also a pathologist. She is in Jamshedpur, that is Tata Nagar in Jharkhand. She is a senior registrar in Tata Main Hospital, TMH. And my brother is he's an IIT engineer, Kharagpur, presently in America. And my parents, my father is a mechanical engineer, presently retired, and my mother is a housewife. So they have in general they have given us a good family. And even after marriage I got very nice in-laws, nice husband, and a girl child. So God has been grateful in terms of giving me a good family who has always stood by me. Because I have done my post-graduation after marriage.
Yes,
and
it's quite inspiring, ma'am.
Still doing it, and I had a child also.
Yes.
Like after marriage, in 1 year I had my daughter. So it was my in-laws were not staying with us that time. Me, my husband, and my daughter, and my devar was staying with me. When I got through PG, my husband requested my in-laws, please shift with us, because she wants to pursue PG, and how she'll be able to do it, because daughter is 1 year old. You cannot take her to college. So they were kind enough to come, and since then they are with us. So last 12 years, I'm married 15 years. So since last 12 years, my in-laws are with me. And that's a big support system in everything, because she's active. She helps in cooking also. She rather does the cooking many times, my mother-in-law. And so that's a big support system, because if you're all the time busy in the housework, it is not easy to deliver a good class, especially before the class. You must be feeling that teachers, they're giving lectures. It's not easy. We have to prepare. And to have a fluent class, to have a good class, of course we know much more than you, so we can take a class without preparation also. But to have a good class, some amount of preparation is required. And for that, some free space in the mind is required. You should get free from house problems for some time, then you can concentrate. And that is possible in my case, because I have a mother-in-law who takes care of the house. Since last 1.5 months she is not here. She has gone to my devar's place. So I'm having a lot of problem. Morning, cooking, breakfast, lunch, all the work I have to do and come.
Yes.
So otherwise there is some sharing of work. So that relieves your stress. So that is so family
I'm
both.
most grateful for your in-law.
In-laws and my parents both. Before marriage my parents, and after marriage my in-laws. And of course a good husband who has been there, and he has stayed for sometimes alone also, because I wanted to study. I'm preparing or I'm doing something, so he has been cooperative. in that respect that yes, you study, you do. He has been very cooperative as a because he's also a doctor and he's a learned person. So he understands what are the problems we face in our profession. So whenever any help has been required, be it in thesis work as a PG student, every time sir has been very helpful. So you'll be going to him, I think. Pharmacology you study, na?
Yes, ma'am. I think it's
So next year you'll go. His name is Dr. Sanjay Kumar. So next year you'll be studying. Okay,
ma'am.
thank you. I gave an interview for